How's everyone doing? So, Straight Chat episode 74, and today I've got a very special guest for you. Today I am joined by a Doctor of Chiropractic Medicine. He's a movement and mobility specialist. He operates his own clinic in Florida, as well as teaching his movement and rehab systems via Prehab 101 across the world. Today I am joined by Jacob Harden. How are you doing?
I'm doing good, man. Thanks for having me on.
No worries at all. There was a lot of big words in there. I nearly messed it up, but I got there in the end.
Yeah, I'm a fan of simplicity anyway.
So how are you doing? What have you been up to? What have you been working on recently?
So spent most of the year doing some teaching. So that's where I've put a lot of my focus for the early part of the year. Everything's been going really well there. I actually just got back from the UK.
Okay. That
A
was
little
the
while
seminar
back.
in London, wasn't it?
Yeah, we did one in London, up in North London. And so I've gotten most of my international seminars out of the way. So we hit up Australia early, went over to the Middle East, went over to the UK, Canada, and now I'm getting ready to start our US tour. So I'm going to get to be closer to home for a little while.
Okay.
Also setting up a brand new clinic in downtown Orlando. So that's kind of been a current project and going to ramp up the treating schedule again for the rest of the year.
Okay.
So a lot of fun stuff coming up.
Oh, cool. How did, obviously you mentioned about quite a lot of international traveling. How has that affected have you still been able to practice at the clinic that you have in Orlando, or have you been sort of had to concentrate more on obviously the traveling side of things?
So yeah, I went to more part-time treatment whenever I do a lot of the long travel. So last year is when I first kind of did the first big like world tour style with it. So I moved to more part-time treatments with that, and really put a lot of focus into, building up the new company, building up that whole side of things, as you kind of have to do early on.
Yeah.
Now I kind of have that on autopilot a little bit more. So that is set. So now I can kind of divert a little bit more of my attention back to the treatment side, dedicate more hours there. And so that's kind of how I've managed it. And so kind of just keeping things going that way.
Yeah. Oh, cool. So for everyone listening who might not have seen the content that you've been putting out there, or know the background and how you got to be in the position that you're in now, do you just want to give a little bit of a background to yourself?
Yeah. So as you mentioned, I'm a doctor of chiropractic. That's my formal background. I also consider part of my formal background to be certified meathead, because I've just been training, weight training for almost 20 years now. But went to chiropractic school, opened up a kind of a sports oriented practice. I treat a lot of athletes and active gen pop, mostly via exercise and education. So that's kind of been my approach, which is a little bit different than the traditional chiropractic approach that most people are used to. I started posting some videos on Instagram about 3 years ago. That's kind of been the main platform that I think most people know me from, and was showing, a lot of just kind of the different exercise progressions I would use with clients, giving my thought process behind why I would do things. And people really took to that. And I found that, both the public and other professionals really liked seeing what I did and how it could help people and that kind of thing. So over the course of, just posting a video every day for 3 years, grew to over 500,000 followers on there. And I think that's how, that's where most people are going to know me from. And that's allowed me to kind of branch out and teach a little bit more in person on how I think, why I do what I do, how I do what I do, and hopefully expand some other people's thought processes as to implementing more of an exercise and education-based approach to managing injuries.
Yeah. Yeah, I know. Looking at the videos that you've shared, I think I've saved quite a few, which have helped me out quite a lot.
That's good to hear.
Has it always been in your mind to go into? Obviously, you mentioned there about growing a following, then wanting to go and sort of teach other people your systems. Was it a natural progression to get into teaching, or how did that come about?
Much more of a natural progression. I never went into it expecting anything. I certainly didn't go into it thinking like, oh, I'm going to grow a following and then I was going to, market that and sell it as something. That was never my approach. My goal is I've always said my goal has been to help one person a day with something they have going on, whether that's via a message or an email or posting a video.
Yeah.
And, you do that enough, eventually it's going to grow, and you're going to see exponentially that you're helping more and more people every day.
Yeah.
It just kind of happened where someone reached out to me and said, "Hey, do you ever like take anyone on as like a student, to like teach?" And I was like, "Well, I haven't, but that sounds fun. Like if you want to, we could certainly kind of set something up." And so she was like, "Yeah, well, I'm going to be in Orlando in about 2 months." I was like, "Okay, well, let's just set up a weekend." So I closed down my whole clinic outside of a few select patients for 3 days. And we worked one-on-one together for about 3 days. And I'm posting up little videos on my Instagram story about what we're doing. And I put up something on my main page, and then people just started flooding. Like, "Oh, like I want to, like, I would love to learn from you too. Oh, like, come here, please come here, come to our city." I said, "Well, like maybe there is something here. Maybe I do." And I guess I'd never really recognized that what I do is a little bit different than other people. And I think now you might see that there's a lot more people out there like me that have a similar thought process to me. But at the time, you didn't see a lot of people just saying like, "Oh, like strength training is the way to rehab." It's not the classic low level, low load PT exercises. And so that allowed me to kind of jump onto setting up a whole kind of tour with it and started the Prehab 101 thing. And so that's kind of how we are where we are now. And I've continued to refine it over time to now it's not even teaching about the exercises so much anymore. It's more about the thought process behind them and the prescription of the exercise, which I think is so much more important than the actual one that you choose.
Yeah. Yeah. Cool. I know, you mentioned there that a lot more people are starting to think along the same lines as yourself. I know from me as a coach myself, sometimes dealing with injuries and bringing people back, it was always an area, I can hold my hands up to this, that I was always a little bit worried about. I wasn't 100% sure of where I should be going with that.
Me too.
Yeah. But actually, the content that you put out there, actually the strength side of things massively helps. And it's actually that, when you look at some of the progressions that you show, or progressions and regressions, it shows that actually I'm not going too far wrong as a coach. And I'm sure there's other coaches out there that are seeing the content out there. And if it's spread to a wider audience, then basically, like you say, helping one person every day, it's just gonna help people progress a little bit more, rather than sometimes people just being left in the dark, not really knowing what to do.
Mm-hmm. Exactly.
So obviously mentioning there about your thought processes and how strength training can help, and if people have injuries, and how they can come back from that. Sometimes for people who don't fully understand injuries or issues with mobility and that sort of stuff, what are your thoughts on, if someone does have an injury or a mobility issue, on the phrase that it's classed as a dysfunction? Because sometimes that can, especially from a client's point of view, that can make them think, "Oh, is there something wrong with me? Is this really, really bad?" What are your thoughts on that?
Well, anyone who is pretty familiar with my content knows I'm pretty big on the psychological side of injuries and how we approach them. And so I don't use the word dysfunction hardly ever with a client at all. And the reason being, not even just from that psychological standpoint, like, "Oh, there's something wrong with me. There's like, this has to be fixed about me," which can lead to dependency on maybe the professional or the therapist, the clinician, to fix them, which we don't really want. We want to promote more self-efficacy and more of what we call an internal locus of control, where the patient feels that they can take control of their situation and they can, move themselves forward. Just even above that, though, if you're going to classify something as dysfunction, well, then you have to classify what is proper function. And it's really going to be hard for you to classify something as proper function when it comes to the human body, because, we're an adaptable system. Anything is proper function in reality, as long as you're moving in a way that doesn't hurt you. Yeah. So yeah, I don't use the term just simply because how do you actually classify it from one standpoint to another? Maybe if we were saying that there is an optimal way to perform, like there's an optimal biomechanical way to move a weight to get the 100% performance level, then anything that deviates outside of that could be classified as some sort of dysfunction. But we probably could come up with better terms than the word dysfunction. We might say suboptimal performance, suboptimal technique, but it has to be classified within the context of what is the outcome that you're actually looking for. If the outcome is don't get hurt, then I think that trying to classify things based on how you move is really missing the boat quite a bit.
Yeah, a key thing from what you mentioned there is how you put it across to the client. Sometimes it does have an impact on how they then think about it, the psychological aspect of it. If you say they have a dysfunction, again, they're going to be thinking, oh no, is there something wrong with me? But putting it across as like suboptimal performance, look, this is what we can improve on, this is what's going to make you better, these are the areas for improvement, rather than just making them feel as though, because ultimately I've had it before where sometimes you might do an assessment and they'll feel if they don't do so well on that assessment, you can see that they'll naturally not feel very, very happy with the result, and they can sometimes be a little bit gutted. But obviously from a coach's point of view, you want to empower them a little bit more and build their confidence up, so ultimately you can...
Absolutely. And I think something you said there is very good. It's something you can build off of. So it's really the connotation behind it, right? So I think anyone who has trained, coached, worked with patients for a long time kind of understands that, some of the bad movement, like air quotes, bad movement that you would see out there probably doesn't actually hurt people as much as gets purveyed.
Yeah.
And it gets better over time. Right? If you work with a client long enough, like their technique and how they move and all this stuff, it just kind of gets better over time. And if we think about how we as professionals and how we moved and what our technique looked like 5 years ago, like it's improved. I guarantee you it's improved, right? And it's just continual practice. So, how you frame it to the client is really big in that, you see somebody's knees really caving together on a squat or something, or on a lunge, rather than just framing that as, like you can't, stop doing that. Don't do that because that's going to hurt you. That's going to be some sort of injury mechanism, which really doesn't have a lot of support behind it, in that that's actually going to hurt you. You could, in the back of your mind, say, that might not be the optimal technique that I'm looking for here. So I'm not going to progress the load as quickly as long as that technique is there. But you frame it to the client as, hey, if we can get you getting these knees lined up a little bit more over the foot where we want them, then, we're going to be able to progress you even faster because your performance is going to be better. And we frame it in more that positive light of, if you do it this way, you're going to be able to perform even better than you are now. And you know what? You're already performing really well. I'm actually really happy with what you're doing. Like empowerment, and continue to push forward, because people care about performance. Like they want to perform better, right? People love their progress. They might not care as much about injury or anything like that. And so if we can frame things from a performance perspective, empower them from the get-go, how you're moving isn't necessarily bad, but hey, we could be better from a performance aspect. I think that's how I would approach it more often than not.
Yeah, absolutely. And ultimately, sometimes, if a client has come to you, that they're coming to you for help, they know that potentially they might have an injury, or they might want to gain muscle, lose fat, or whatever it may be. But ultimately, they've come to you for help to guide them, to help them progress to their goals. They've not come to you to say, "Oh, well, you're rubbish at this. You can't do this. We need to be able to do that."
Right.
Just in terms of from a coach's point of view, and how sometimes the word dysfunction can be used. Do you think sometimes that it's down to the assessments that are actually chosen by the coach? Do you reckon sometimes that by using different assessments, for example, if someone comes in who say struggles to get up and down off the floor, doing, for example, the trunk stability push-up test on the FMS test. Mm-hmm. Giving them that test, straight away from sometimes when they've walked in that they might not be able to do that test. Do you think sometimes that coaches can back themselves into the corner with the battery of tests or assessments that they use?
Yeah, well, people want answers, right? People want to get an answer to whatever you're doing. If you're going to provide a test, they want to know the outcome of the test. Yeah. Did I pass? Did I fail? Yeah. And so if you're going to use some sort of assessment, which you should be using some sort of assessment, right? You should see how, if this client can actually do the exercise that you want them to perform, then you need to have some sort of way to frame it to that person. So if somebody's doing this trunk stability push-up and we see them really sagging through the low back, we see those hips drop as they push themselves up, rather than telling that person, oh, well, yeah, that's a fail, or that's a 1, and we can't have you doing push-ups right now because of this. We got to get your core, like your core is weak, your core is unstable, might even be the term some people would use. Yeah. How you could frame that is to say, yeah, so it looks to me like we want to, before you ever even tell them about an outcome, have them do the same push-up from the knees.
Yeah.
Right. And then you watch them from the knees and they're fine. It's like, okay, so what we actually found there, rather than calling it any sort of movement dysfunction, rather than calling it any sort of instability, whatever, you're finding the training technique that seems to be the best starting point for them.
Yeah.
So you did the trunk stability push-up. It looks like that technique wasn't quite there. It's not quite there yet, whether that is strength, whether that is control, whether that is they just need more coaching with it, whatever it is.
Yeah.
But then you put them to the knees. It looks great. Then that's probably just a better starting point. And so how I would frame all that stuff and all these battery of tests is to say, we're looking for the exercise options that are going to be best for you to get started with.
Yeah.
And so then you don't really back yourself into a corner, because you could always just say, we haven't found it yet. We just need to test a little bit more to see what that best exercise option is for you.
Yeah, I think that was a really good explanation. I think sometimes that it can be, you can modify some of the, like you say, if it was the trunk stability push-up, modify it so that they're doing the push-up from the knees. I think sometimes if it is just a pass-fail, people can sometimes get a little bit disheartened by it, but you can always modify it and exactly what you say. Keep looking through different assessments and look. We haven't found what we're looking for yet, but you can still progress through.
Yeah, exactly. You just gotta know what you're looking for, really. I mean, at the end of the day, you're just trying to find a way to get somebody exercising, get somebody moving, right?
Yeah,
that's really what you're looking for. So just find the technique that looks the way you want it to look, or that you feel is a starting point that you could coach them from. Yeah. And really, man, just take a lot of the BS out of it. Like some of these terms that we use, like mobility. Okay, do you have the range of motion to do what you want to be able to do? Okay, if you don't, let's find a different option. Yeah. Stability, like, is the ability to resist an external force. I mean, that sounds like strength to me, right? Yeah. With an element of control and technique.
Yeah.
So, okay, you don't have the technique. Well, let's try and coach you.
Yeah.
Oh, so if I coach you, when that's what we see, like when people are coached, their FMS scores all of a sudden go up. Right.
Yeah.
So, so do you have the strength to do what we want you to do? Have you been coached on this, or do you just need to learn? In which case, let's practice. Or do you not have the range of motion for it? Okay, well, let's do something that doesn't require as much range of motion, and then we'll gradually work on improving that. Yeah. And you're just trying to find the right starting point, and then know kind of where your end goal is, where you want to go, and really just take the dysfunction out of it, take the stability out of it, take the terms people just don't even understand, which honestly, I think we use a lot of times to make ourselves sound smarter to the client, and really bring it to their level so that they understand what it is that you're doing, because people actually appreciate not feeling dumb. Yeah. People appreciate that you can come to their level and that you can explain things to them, and that's going to increase adherence, that's going to increase rapport, and that relationship that you're building with that client too.
Yeah, absolutely. I think sometimes people can come in, and if people, I've had it before, starting out as leaving university and starting out as a coach, I wanted to use all the biggest words and show what I can, show the knowledge that I had. And ultimately, sometimes exactly what you say. People, when the word dysfunction is used, they can become a little bit dependent on the coach, and think they're actually at a lower starting point than what they actually are. But as I've followed coaches such as yourself, and tried to increase my knowledge base, actually sometimes it's like, look, do you actually just need coaching on this, exactly what you've said, or does the range of movement need to be changed? Just on that note, then, where do you think this the whole phrase of dysfunction, and where do you think that mindset has come from some areas of the coaching world, if you like?
Yeah, I don't know. I think it's probably around before I even came into this whole healthcare world. In all honesty, it's sure it's been around for a long time. I think a lot of it came from the functional movement wave that kind of came through. I can't be sure on that, but that is kind of my best guess as to that. As far as okay, here's a right way, here's a wrong way to move. I think for as long as we've been telling people that there's a right and wrong, well, that wrong, now we're just giving a word to it.
Yeah.
And if we can just realize that maybe there's not necessarily a best way for a human to move, and there's a lot of variable ways for humans to move, then that word carries a lot less weight. And then we can bring it back to that kind of that performance thing we talked about earlier, in which case there is an optimal way to move for performance. There's a suboptimal way to move for performance. And we don't really need to label anything as dysfunctional or, something that might have a negative connotation based on the prior experiences of that client.
Yeah, absolutely. So in terms of, when people are categorizing things as good movement, bad movement, what's right and what's wrong, what have you found to be sometimes the common areas that can be mistook for dysfunction? Because there was a thing, I was actually chatting about it with the other coaches that I work with at the gym that I'm at, and basically it was talking about anterior pelvic tilt. Okay, so most people are in some form of anterior pelvic tilt, and there are foam rolling stretches essentially, and movement as well that can help with that. Now, I wouldn't class that as a dysfunction, but in some areas, the anterior pelvic tilt, it's really, really bad. You should be trying to get out of it. But as mainly sort of general population clients coming in, everyone has some form of anterior pelvic tilt. So
most people have it.
Yeah. What have you found to be the common areas that people mistook for dysfunction, and the areas that people misunderstand sometimes?
Well, I mean, that's a huge one. I mean, pelvic tilt, the rounded shoulders, the rounded back, the arched back, anything outside, anything that deviates from neutral seems to get labeled that way, right? The knees caving in, the rounded back on the deadlift, you name it. If it doesn't look picture perfect, it's probably been labeled something. Yeah. And that was actually a good point that you brought up, because going back to the previous question of, where did the dysfunction term come from? Well, the anterior pelvic tilt thing kind of came from Jonda's upper and lower cross syndromes, where, with the anterior pelvic tilt, the thought process there was, well, it was tight hip flexors, weak glutes, tight lower back, weak abdominals. Therefore, this imbalance in tension led to the pelvis going forward. And there's not a lot of support behind that, actually. And muscles don't really work that way. They're not just statically pulling all the time, they are, whenever you take something to an in range, sure, if you have limited hip extension, then the pelvis would probably tip forward to, help you achieve that motion or something. But, the dysfunction term may have actually started there at these syndromes, and as to, is it a problem? Well, if most of us are walking around with this stuff, and most of us are asymptomatic and we don't have a problem with it, then why are we calling it a problem? Yeah. So I think a lot of it comes down to, people just don't understand why, at the most fundamental level, why injuries actually occur, which would be when the load you place on the system exceeds your ability to withstand it, you get hurt. Yeah. And that could be in an acute situation. In the case of a linebacker barrels into your knee, acute overload happens and something snaps, right? Or it could be that you've been increasing your training load, you've been increasing your training volume and your intensity by 25, 30, 35% week after week after week. And that led to some sort of more cumulative overload, right? And then once you're hurt, so this is the issue that we run into, is that people seek help after they're hurt.
Yeah.
So a lot of times we don't see how someone moved. We don't see what that posture looks like. We don't see any of this stuff until after they're hurt and until after they're sensitive. Mm-hmm. So once something is sensitive, anything can go. So what we will often see is that, okay, now my back hurts because let's say that I increased my training volume 30% over the last 4 to 6 weeks, and I was super stressed and my kids were sick and I just was under recovered during this time period. Maybe I tried to run Smolov or something and increase my squat by 80 pounds and I just wrecked myself, right? Because it's just, we all know you can do way too much too soon. So now you're coming to me and your back is hurting. Well, your back is sensitive to extension. So I say, hey, why don't you try tilting your pelvis backwards a little bit? Because I see you're in this large amount of extension. And then you do that, and all of a sudden, like, oh man, that feels like it took a lot of pressure off my back. Like, that feels good. And so we then retrospectively call the position they were in a dysfunction.
Yeah.
We call that, I was like, oh, well, that must have been the problem. That was the thing that was creating your pain. No, the thing that created your pain is you had really bad programming. And like you overdid it and you didn't manage your fatigue and your loads and your recovery very well. You then came in, you were already sensitive. And what we didn't actually do, we didn't actually change or correct. We did not correct your movement. We altered your symptoms. Yeah. And so something I want people to realize is that symptom modification is not movement correction. That's a big deal, is that a lot of things can modify symptoms. Sometimes moving someone out of a perfectly neutral position and into an anterior tilt or into a posterior tilt or into like letting someone look down and getting a little more forward head posture or something, that's going to modify their symptoms better.
Yeah.
Right. But just because you move someone out of a position that you don't like doesn't mean that it was a problem in the first place. It just means it feels better right now. And once the sensitivities calm down, they can probably go back to that same old position and be just fine with it.
Yeah, absolutely. It's interesting what you mentioned there about, what actually causes injuries as well. I think sometimes that information isn't, or people don't fully understand. So therefore they try and think, now that I'm out of this position, like you say, it must mean that this is better. Using the example of the anterior pelvic tilt, a lot of people will be in it and they might hurt the back, exactly what you've said, by squatting, and then it'll be right. Well, before that, when you were walking around day to day, you were already in a pelvic tilt. Were you in pain? No. Then
you've been there for the last 20 years.
Yeah.
Why weren't you in pain then? I mean, and you could take that all the way over to someone who's like pulled with a rounded back in their deadlift for the last 10 years and they've never gotten hurt. So then if they actually do hurt themselves, was it the technique? Or was there something else going on there? Because 10 years nothing happened. And we can't say that like, oh, well, I pulled with bad technique for 10 years. So there's my issue, like your body adapted along the way. Otherwise you would have broken a lot sooner.
Yeah.
So, this is where it gets murky, in that maybe for person A, they pull with a rounded back and they can only progress their training load by 5% per week. Because of their genetics and their lifestyle and everything that happens. And if they pull with a flat back, they might be able to progress 15% a week, right? So it has a different ceiling versus person B, due to with their genetics and everything they got going on. Maybe they can progress 20% a week, no matter which technique they use. Yeah. And in all honesty, you just don't know. But if you have a history of someone's like, oh, well, I've just kind of always done it this way, it's never been an issue for me. Well, we can't label it as it's going to be a problem. We can't predict it's going to be a problem. And that's where it kind of comes back to, you can't frame these things from a health perspective. You have to frame them from a performance perspective. And say, okay, well, I think you might have a better ceiling if we move this way. And then I think that we avoid a lot of the potential issues.
Yeah, absolutely. And when you were saying it there, someone might be able to progress 5%. People might be able to progress 15%. Ultimately, it comes down to the person. And it's funny. I actually had this conversation with a guy that came to the powerlifting club that I run at the gym that I work at, and he was actually chatting about rounded shoulders. It was actually rounded shoulders in the deadlift, and my response was, you sometimes look at some of the biggest deadlifters in the world. They lift crazy amounts of weight and they've got rounded shoulders. That doesn't mean to say somebody who hasn't been training as long as them, have got their training background, their genetics, can lift with rounded shoulders and lift the amount of weight that they have. Because what might work for that one person might not work for someone who hasn't trained that long and is just coming to the powerlifting.
Right. And you know what the difference is? The difference there is exposure. Mm-hmm. What have you been exposed to? I mean, if you deadlift with absolutely perfect technique, but you did 10 sets of 10 day one in the gym, how are you going to feel? You're wrecked. You're absolutely wrecked, right? So, I mean, likewise, even if you just came in, you said, okay, well, I'm just going to, first day in the gym, it's RPE 9. When we're going everything to failure, everything 1 rep off of failure, everything to failure, like, how are you going to feel? Like, well, you don't have that baseline exposure and that baseline resiliency to withstand that level of workload day one, or most of us don't. I mean, maybe if you grew up on a farm, you've been slinging hay bales around for, half your life, then maybe you do. And that's where it really comes down to the individual. So, but to say that, oh, well, what if they did train that way? What if they started light? What if they started at an RPE 6, really stayed really far off failure, low volumes, and they started with those kind of like rounded shoulder position, and then they just trained.
Yeah.
And then they gradually dosed it up, just like we would with any good training program. You would gradually dose it up. They'd probably be fine.
Yeah, absolutely. And going on a little bit of a tangent, if you like, but that's where, when you look at the injury rate of people that are getting involved in CrossFit, they've gone from doing potentially not that type of training at all to then doing, all these big crazy movements, thinking that they can do that, and they haven't had that background in it. So obviously their body isn't going to be able to deal with it, and then that's where they end up coming to see coaches with an injury. And actually, it's like, well, look at what you've done before. Look at the load that you've ended up putting on your body, and that's the injury. It wasn't a case of, oh well, my technique on my clean and jerk or my snatch wasn't good. It's the fact that you were doing that and then doing it, maybe not as much training beforehand.
Right. And, I would love to see a study that looks at like CrossFit gyms that have an on-ramp kind of programming style, where everyone has to kind of go through their little on-ramping procedure and learn a little bit first, and some lighter workouts versus those that don't.
Yeah.
I would bet that we'd probably see a higher injury rate in those that don't have that sort of on-ramping type of programming. But, you look at whenever we take people through that style of programming and we're teaching them the technique early, really a lot of what we're giving them is very controlled exposure. Mm-hmm. It's just a way to give somebody some sort of exposure before you make them go balls to the wall.
Yeah.
Right. You typically are going to keep the weights light. You're going to practice, and you're just like, that's what it is. It's practice. And you might practice for a month before you really go hard with it. And what doesn't get talked about a lot is just like, that is building some sort of resiliency in you, even though it's easy, though it should be easy. Right. But like, keeping our technique together and all this, it's really a form of fatigue management. In that, by taking the time to learn that, you're putting them in a very low fatigue environment, a very low stress environment to get that baseline exposure. And then on the flip side of that, if we've been training a while and we're very strict with our technique, well, again, it's a fatigue management thing to where, look how many burpees could you do clean? Right? Like, you would probably reach failure a lot sooner than if you really let your technique degrade and you do another 10 after that. Yeah. And the same thing with like an Olympic lift. the Olympic lifts were never meant to be done into high fatigue states. Like that's what power exercises are, right? They're meant to be in very low fatigue states so that we get that maximal rate of force development. And if we continue to push and push and push those for some sort of time or some sort of rep count that we're supposed to be getting, it can, and when you don't have the work capacity there, then you can kind of have reached failure and then just kind of have kept going on top of that. So you have really poor fatigue management with it. And so, it's so multifactorial. I mean, there's even the aspect of something like with CrossFit where people just really enjoy it. Mm-hmm. And they might come in a very untrained state or this is a brand new stimulus. They really enjoy the community aspect of it. So then they start coming 5 days a week. And so 5 days a week and every workout they're doing is really high intensity and it's really tough. And, they're rating them all as like 9 out of 10 effort level workouts. Well, I mean, how sustainable is that?
Yeah.
Probably not. So, we know that we should probably have some sort of undulation where if you have a really hard 9 out of 10 workout, maybe you should have a 4 to 5 out of 10 coming up with that somewhere in the week so that, you're really pushing yourself, but then you're giving yourself a little bit of recovery time too. And I think these are the things that we need to be focused a little bit more on. We need to pay a little bit more attention to, the person that in their mid-30s who joined boot camp to get their body back and really fell in love with it and then started going 4 or 5 days a week after having not worked out for a while. Like, why are we not talking about that? Why are we not talking? Like, obviously we're very happy they're exercising, but we need to still have that conversation of, this is pretty high impact. This is pretty hard workouts. We're really trying to push here. So the education process behind that of, hey, not every workout's meant to kill you, could probably save a lot of people from injuries.
Absolutely. And it comes back to the point that you mentioned at the start. It comes down to the actual coaching side of things and not just letting people, run away with it. And 100% educating people on, having lighter workouts, having a little bit of a deload, focusing on recovery is important. It has to be there rather than just because there's only so much. It's got a very limited shelf life. Just hammering yourself, throwing yourself at a brick wall, and having really, really high intensity workouts or lifting heavy all the time or whatever it is. Because ultimately something is going to give. And it's not always the fact that, going back to that point of the anterior pelvic tilt, it wasn't the cause of that has caused the injury. Just in terms of it, and you touched on it briefly, when we were chatting about dysfunction and fixing things. So does, on the point of things being fixed, what are your thoughts on, does everything have to be fixed? Is something there? Because obviously you mentioned that any movement away from neutral could be classed as a dysfunction, or not the norm. What are your thoughts on fixing things?
Oh no, not everything needs to be fixed. I mean, if you're gonna say something needs to be fixed, you should have a good rationale behind why you want to do that. First off, I'm really not a huge fan of telling people they need to fix things. I would much prefer the term improve if given the choice, right? And again, it's that connotation thing. So you need to know the person's goals. And if does this person have aspirations to be on a world-class stage of competition? Well, yeah, you probably need to optimize every little, fine detail as you go along. Now that needs to be built on a foundation first of adherence and proper programming and time and consistency and yada, 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 right? And we need to make some progress that way. And then like that icing on top should be, hey, we're going to really get every little fine detail here really set, versus if you're working with somebody who's just like, I like going to the gym a couple times a week and I just want to stay healthy and I want to be able to play with my kids. And I don't ever really plan on competing. I just really enjoy kind of being here. You probably don't need to be focusing on 100% optimization of every fine detail, because one, you're you're probably never actually pushing them to like their maximum recovery abilities.
Yeah.
From a programming perspective, they just don't need that. They can work much more at like a minimum effective dose kind of volume level where it's a lot safer. They're never going to like push those thresholds of overreaching.
Mm-hmm.
And with that comes a lot more leeway in things, in that things don't have to be as optimal on all the time. Like they don't have to have every bit of their sleep down to 8 hours a night. They don't have to have their nutrition on point every single day. They can be a little bit more stressed, and we have leeway because we're not stressing them as much over here on the training side, versus, when you want optimal results, every single aspect of your life is going to have to be optimized around that result.
Yeah.
So does everything need to be corrected, improved? No. Could certain things? Yeah. Certain things could be improved upon. And that really comes down to, do you want to perform better here? Do you want to, have that higher ceiling and be able to progress a little bit faster here? Then maybe you could work on improving that. And that's going to be on an individual basis based on who you're working with.
Yeah, absolutely. And, I found it interesting there when you're talking about if it was, say, for example, the general population side of things, they don't need to be, as you say, optimal to compete in powerlifting or CrossFit or whatever it may be. A phrase that, that I quite like is they're basically training for life. They're just, want to make sure that, that they can play with their kids, they can, carry their shopping and all that sort of stuff. So nothing necessarily there might not need fixing, but might need things to stay on top of, so that, if they are playing with their kids, they don't put the back out, or, or whatever it is. Looking from the other side of the fence, if you're looking from optimizing, performance, there might be some things that if their knees are always caving in, that might be something that you need to correct to make sure that whatever sport they're playing, they are optimal for that.
Sure.
On the topic of that, what are your thoughts on, because sometimes I've had it before working with clients, and some people might always be foam rolling their quads, or working on ankle mobility, or working on shoulder mobility. And sometimes people, is this ever going to get better? But for example, working at a desk all day and the shoulders rounded, that's something that always needs to be kept on top of. What are your thoughts on having that mobility work and rehab work in the background, and having that continuously worked on?
If it's something that person finds value in, then it's fine to do. We know that those like passive implements, like a foam roller or something, this is really going to give kind of a temporary effect on their mobility and whatnot. The thing that's really going to kind of lock that in long term is actively using it. Yeah. So, if you hang out in one position all day long, and for 10 hours, and then come in, you try and get into another position for 30 minutes, 45 minutes, then it might be a little bit tough to do that. Versus, if you just raise your arm over your head, a couple times a day, maybe you'll maintain that a little bit easier. None of those implements they're not necessary. Like, you don't have to necessarily foam roll your mid back. You don't necessarily have to foam roll your ankles or your quads or whatever. There's plenty of ways to get that. I mean, a good dynamic warm up could probably give you the exact same effect. Yeah. But if someone finds value in, like, they like the way it feels, it makes them feel ready to train that day, that's fine. No problem with them doing that. Again, you have to know, are they cool with that? If it starts to cut into the time that they have to actually put work in, then I think we need to have a conversation about, most bang for our buck, and where we could get a little bit more value out of our training. And that's probably going to come from removing some of those low value options, like laying on your foam roller.
Yeah.
So in order to get that, and again, here's where it comes down to goals. Hey, what's your goal? well, I really want to, do you want to be able to make progress here? Because right now we don't have enough time to do that.
Yeah.
They're like, oh yeah, I do. Okay. Well, then we need to get the time. Well, but I feel like I'm not ready yet because I feel like I'm so stiff. Well, then you need to adjust something in your day-to-day life to make sure that you're not coming in feeling that way, so that then we have the time, so then you can make that goal.
Yeah.
Otherwise, are you happy with the progress you're making right now? Are you happy with the way things are? And they're like, yeah, I am. Okay, well, then I guess you don't technically really need to change anything, because at the end of the day, it's about that client. What's their goal? What's their happiness? And we can't necessarily impart our own vision of that onto them.
Yeah. Yeah, absolutely. And it's interesting that you mentioned about foam rolling there as well, because sometimes people will come in and they'll the whole thing surrounding foam rolling is that if you like it, do it. It's more of a sort of a neurological aspect of it. There's no sort of like you don't need to be doing foam rolling all the time. Like you said, a little bit more dynamic warm up can 100% reach the same end result. But some people have come in and it's just sort of robotic and routine-wise that they'll just go straight for the foam rollers. And really, it's like, yeah, okay, spending 5 minutes foam rolling your quads, but do you feel better after it? And when you mentioned about the psychological side of things, in their head, they might be thinking, right, I foam rolled. Okay, so now we'll go into the other side of things. And I don't think that's necessarily a bad thing, because you can you can speak about the research, science, the everything else about it, but ultimately they like it and it makes them feel better. Right, that's what we're going to stick with, and then we're going to try and maybe add in one more thing every time to help improve that, which has been a key word that we've been saying over the couple of topics that we've chatted about.
Yeah, if again, a lot of people have their ritual. Like, oh, I do this every time I train, and if they want to make their way towards more simplicity, then we eventually need to phase some of that stuff out. And if they don't want to work towards simplicity, then we don't need to phase that kind of stuff out. Again, if they have the time, or they're like, they show up 15 minutes prior to their session with you every day to get that kind of stuff in, and it's not affecting their training in any way, have at it. I would prefer if they don't have some sort of false narrative around it.
Yeah.
No. And I think that's another key component in the education process of, we know that it's not breaking apart scar tissue or adhesions or fascia or whatever, that maybe they're coming in thinking it's doing that. And they might think that it's necessary in order to be like, they might be under the impression that, oh, well, strength training makes my muscles tighten up, and so that's why I need to do some cool down stretching. And it's like, well, no, you don't really need to, because strength training doesn't really tighten your muscles up like that. Or I need to foam roll, otherwise I'm going to somehow get injured. If I don't foam roll, then it's only a matter of time before I get injured. Like, that's a false belief system that can kind of become self-fulfilling prophecy, in that, well, what happens if they're traveling? They don't have access to a foam roller. At the worst case scenario, now they feel like they're setting themselves up for injury. So then they feel some sort of little twinge, and they catastrophize it to the point that they really believe it is some really bad injury. And then they, circle back to, it's because I didn't foam roll that day. That's why my knee, finally got me. Or, maybe what if they don't perform that well that day because they didn't have their ritual, that thing that they kind of got addicted to. They're like, oh, I just can't train today because I haven't done this.
Yeah.
So, I don't like people becoming dependent on too many external modalities in order to feel like their body is capable, because your body's almost always capable at all times, just depending on fatigue levels. And use things strategically to whenever you feel like they are going to serve a good purpose for you. And outside of that, then I think it's probably best that we just, if people have their rituals, they understand this makes you feel good, but it's not going to do anything special for you. You can totally perform without this if you wanted to. It shouldn't be a hindrance if you don't have it. You're not going to get hurt if you don't do it. And they really understand, like, I'm doing this because it's my preference.
Yeah.
Cool. Go at it.
Absolutely. I really like the point that you made there about people being dependent on, sort of the equipment side of things. I know from competing in powerlifting myself and running a powerlifting club, people always ask, what about knee sleeves? What about belts? What about this? What about that? Right. Let's get strong enough to a point where you don't need belts or knee sleeves, where you don't need to be dependent on them. And then when you get to a point where you're actually going to go and compete, then we'll start looking at knee sleeves. Then we'll start looking at belts. Because I've had it before where people, I just need to put my belt on for the warm up set. It's an empty bar. You don't need to put your belt on for that. When you get to a certain point, and like we were talking about, if you're going to an RPE 9 or something like that, yes, okay, let's start looking. We're heading into a competition. We want to be using a belt. And when you're saying, if someone's had a workout or is away, and the gym that they're going to doesn't have a foam roller, those little niggles, like you say, can be blown up to be a lot bigger than what it is. And then all of a sudden you're in a negative mindset, and you're not going to be able to do the training, the training that you need, or the workout that you're going to do. I think the actual psychology of injuries and we mentioned that word dysfunction and fixing things. I think that plays a big role in what sometimes prevents people from actually going out and looking for help. And like we said at the start of the chat, using strength training to actually benefit them, rather than saying, nope, I can't do any of this anymore. I need to stay away from those exercises altogether.
Yeah, I think also people need to realize that strength training isn't about moving a weight. Mm-hmm. It's about applying a stimulus. Yeah. So, at least in training, it is. You go to competition, it might be very much about moving a weight, but it's really about applying a stimulus. So people aren't very good at reacting, and auto-regulating is probably the better term that I think everyone understands. Yeah. Is they're not so great at auto-regulating to, let's say if you've written out a percentage-based program that is based off of your belted 1RM, any percentage that 75% of that is not 75% unbelted, right? That's 75% belted. Yeah. So if 75% that day belted was supposed to be an RPE 7, a fairly moderate to light workout, but you didn't have your belt, and you go and you do that exact same weight because you think it's about moving that weight today, then now all of a sudden you're at an RPE 9, RPE 9.5, because you can't create the same level of intra-abdominal pressure and stiffness, and you don't have the same speed, bar speed and everything with it. So now you've just induced a lot more fatigue on yourself by doing that. Yeah. So if you realize though and this, I think, is something that as coaches or as a clinician, working with somebody, it's important that we help a client understand that it's more about, hey, today's supposed to be an easier day. Today's supposed to be a harder day. Today's supposed to be whatever level of stress that the day is supposed to be, because then you realize that it's not about the weight, it's about getting that stimulus. So, if we told them, rather than, okay, go up to whatever X amount of weight for 8 reps and do it, which in our minds as coaches, you may have written that out to say, okay, 8 reps, but that 8 reps is supposed to be really easy because you programmed it at a lower percentage. But then when they didn't have their belt, that 8 reps all of a sudden became a much higher percentage. It became a much harder RPE. And so if they understood that, hey, I want you to go to and do 8 reps and do it at a weight to where you just start to feel a little stick. You just start to feel a little bit of a slowdown, and that's your stopping point. No grind today. Nothing, no grind at all. Yeah. Then that in and of itself, without even assigning an RPE to that client could then auto-regulate that to, like, okay, I don't have my belt today. So during their warm-up sets and during their workup sets, they kind of get to that point, and maybe it's 30, 40 pounds lower than what they're used to, but they hit that point and like, okay, well, that's the stimulus for the day because that's the current environment that my body is working within, and I'm going to do my job today. I'm going to wrap it up into this nice little package, which is one training session, which plays very, very little into the grand scheme of like a full macro cycle.
Yeah.
And, and we're just going to move on, and then we're going to, maybe we didn't get the most fitness stimulus out of that workout today that we were after, but you know what we didn't do also? We didn't overload our fatigue.
Yeah.
And that's huge, because fatigue can rock an entire training block.
Yeah.
Versus, just missing a little bit of stimulus might not be the worst thing in the world. That we can make up for that.
Yeah, absolutely. It's more of making people aware that it's more of a quality workout than trying to just get as much in as you can.
Right.
That is something that with the clients that I work with, that I try and again, we've mentioned it a couple of times, trying to educate them on that. Okay, so for example, they might be doing a lunge, right? So it's weighted, they're a little bit tired, everything's all over the shop. Let's drop the weight down. Let's focus on that good movement. Let's make that, like you say, that stimulus. Still can't do it with a weight, right? Take the weight away. We're doing a body weight lunge. You're still gonna get the stimulus.
Right. If that's where they're at that day, that's just where they're at that day.
Yeah,
right.
Absolutely. And I think that sometimes people are thinking, like you say, oh, it has to be loaded. I need to be lifting some weight, or God forbid, all my gains are going to be lost. But really, again, it's that auto regulation, like you've mentioned. It is the quality, rather than running yourself basically into the ground, which may ultimately lead you to an injury.
Right.
On that note of, obviously, you chatted there about auto regulation, and if people have an injury, so they've got so they can get a quality workout. How do you manage, or how do you coach people who have an injury and manage that around their training? How far away would you go from the core exercise that was planned that day, if you like?
I try and stay as specific as possible when advising somebody on that. And a few reasons on that. One is just that it just kind of helps them maintain a sense of normalcy, which is good psychologically for a person to not feel like they're totally out of their groove and they're not totally out of their element. Yeah. They can feel like, okay, like I'm still doing something. And especially as people who are used to kind of pushing themselves, we don't like to feel like we've regressed ourselves all the way back to clamshells. And it's like, dude, what the hell am I doing? This feels like I might as well not even do it. Yeah. Even though those clamshells may be perfectly, applicable to what that person needs right now. If we can help them at least understand why they're doing them, and that we don't take them too far out of their element, I think it's good for that purpose. The other thing is, if, let's say somebody's knees hurt when they squat, so they're having some sort of whatever, knee pain. Well, if a squat hurts it, then a squat pattern triggers it. I may not know exactly what the tissue is that is hurt, but I know a squat touches it. So via staying as specific as possible to that movement, I'm guaranteed that I'm touching whatever it is. Yeah. I may not know what it is, but I'm guaranteed to be touching it, just because simply the body's telling me that I'm touching it. Yeah. So that's the other aspect of it, and then you can dive multiple directions into that. Whether, if you're a coach and you don't necessarily work with pain, that's not within your scope of practice, then maybe you're trying to find a pain-free option for them. You're looking more at the biomechanics of it. Okay, well, they have knee pain when they squat. Well, what's the squat? Well, right, it's loaded knee and hip extension. All right, it's going to be primarily glute, quad, low back stimulus that we'd be losing by not squatting. So let's come up with another option. Hey, can you do heavy step ups? Yep, I can. All right, well, there's one option for us. Can you do some back extensions? Yep, I can do those. All right, there's another option. And so that's how the coach might approach that, is more biomechanically, what was this movement doing for us? We can't do that right now because it hurts them. What's the next best thing? Yeah. And the next best thing might simply be, hey, a box squat is pain-free. Well, that's, again, guaranteed you're loading the same muscles, loading the same joints, because it's the same pattern. So therefore, you can then load that, train that pain-free, keep them strong, keep them in shape. And really, you're doing your job of, you're not taking them out of their element. Like they still feel like they're pushing themselves. Again, very good psychologically for that person's recovery. They're not going to catastrophize that injury nearly as much.
Yeah.
From my perspective as the clinician, I like to poke the bear a little bit more. So I might push somebody into symptoms. I might want them to feel that symptom, but feel it at more of a tolerable level. Realize that that's okay for them to feel it. Because if I always work pain free, I don't necessarily know if something's getting better.
Yeah.
So I like to push into those symptoms a little bit more, and so maybe I just find a load differential that they can work with that makes them feel it a little bit. Or maybe I find a slight change in their knee travel or a slight change in their depth, and we kind of work into that symptom a bit more. And again, I'm going to try and stay as specific as possible because at least I'm guaranteed to be touching it. And if I can't, if nothing's tolerable, maybe we have to go to a lunge, because then I know it's at least the same joints, the same primary biomechanical pattern, or maybe it has to go all the way back to a leg extension or an isometric or something like that. But I try and stay as specific as possible for those reasons.
Yeah, absolutely. And, it comes, what you're saying, what you mentioned there is, I think it's focusing on what people can do, not what they can't do.
Absolutely.
And the whole thing that you mentioned in there about pain, I think sometimes, yes, if something causes pain, there is that thought process that, oh my God, I don't want to do this. I don't want to do this again. However, I think sometimes, like you say, pushing, poking the bear a little bit more and pushing it a little bit more, it is okay within a controlled within a controlled environment.
Right.
Would you agree? Is that what you're
Yeah. I mean, you can decrease fear. You can show them that they're capable of something. You show them it's not as bad as maybe they think it is.
Mm-hmm.
And that in and of itself can help to reconceptualize how they feel about that movement or about the pain or about whatever. And so things can just kind of naturally subside on their own, because pain is an output of the brain. It's a sensation. It's not something that it's not an input. It's not like we don't have like pain fibers, pain nerves. It's everything that's going on, all of what your nerves are getting as like afferent sensory input coming into the brain, as well as all the ways your brain is processing those signals. So all those thoughts, all those fears, all that anxiety, all that comfort, everything that you have going on leads to, okay, what's this output? Yeah. Pain, intensity of pain, level of pain, right? So if we can alter how somebody's maybe processing that pain, I think that's a huge part of it. If we can just alter the load, which would be more like altering the input side of that equation, then that can help us as well. And then we just gradually find that right dosage for that person and figure out a plan to kind of build forward back to whatever normal is.
Yeah, absolutely. And the thing there, what you're saying is, altering the load and progressing to get back to where they were before. I think sometimes, going back to that point of that sometimes people, when they have an injury that they think they're at a lower level than what they're at, they can sometimes spend too long in that level, or the coach will allow them to spend too long in that area, rather than looking to be like, right, let's get back to normal, like you say, whatever that might be for that person, and let's start working towards that, rather than thinking, oh, so yep, we're never going to get back to that point anymore. We've just got to work on the lower end of the spectrum. I think, I know from following the work that you put out there, obviously, it is looking for progressions and ultimately building it back up.
Yeah, and some I'll do with clients is, I get them in on that process too. Of sometimes, I'll ask them like, if let's stick with our squat example, if you feel like you could do, if we can do 12 reps with this weight, are you confident that you could go up 5 pounds, and not have that be debilitating to you? And, most would say, yeah, I think I could probably do 12 reps there and then be able to go up 5. Okay, well, that's kind of a good starting point for us to set as like a rep target with the current load that we found to be tolerable to you. And then we can work off of that, if they're like, no, I don't know. I'm still a little bit nervous even after they've done it 12. Okay, well, do you want to go to 15? Sure. I think 15 would be better. I feel more comfortable with that. Okay, let's do that. Because again, you're trying to alter that processing side of things to where their brain doesn't freak out with that next increment.
Yeah.
And as you get them closer and closer to it, and you've had these conversations and you're just working with them, then eventually you are going to reach a point where they are more limited by effort than they are by symptom. And that's training again. Like that's getting physical stimulus out of it. And, now you're back into your training scenario all over again.
Yeah. I think it's, I quite like the fact that you used, I think it is one of those things that a client will freak out because they are worried. They are sort of, again, going back to the point that we started at the start of the chat, they've come to you for help. So, speaking to them on their level, making sure that, you're not making them out to be this drastic, awful thing. Like, ultimately, it's like, are you ready to progress? No, I'm not ready for that. That's fine. Let's keep working on what we're doing, change it around and all that sort of stuff. Rather than letting them freak out or just again staying in a lower state.
Right. And on the flip side of that, we should mention the flip side of that. Some people are just going to be chronically scared of pushing forward.
Yeah.
And that is where you're going to have to, take the lead there and say, no, do you trust me? Like, you can do this. Like this, you can do that. You can get a little bit lower. You can add that next 5 pounds. Like, I'm sure you can do it. Yeah. And maybe they're very timid about it, early on. Maybe they're a little scared of it, but the best thing in the world to get somebody past a fear is to show them and have them kind of be exposed to it. So, there is going to be that flip side of, you can't always let the client take the lead and say, no, I'm not ready for that. I'm not ready for that, because we do have to push forward at some point. And if we're confident, and we're very, very confident that they can, and that they're in a situation they can, then we might need to educate a bit and, talk to them and try and just really kind of push the envelope there towards that side of things.
Yeah, absolutely. And I think that goes into the realms of, as a coach, that there's that saying that a coach has many hats. It's a shoulder to cry on. It's there to be, maybe using the stick a little bit more to push them a little bit. I think that comes down to the art of coaching and knowing, ultimately building a relationship with your client and knowing.
Yeah. I think for coaches, a lot of the analogy I try and use a lot is to take the injury out of it a little bit when it comes to those scenarios, and just ask yourself, well, how would you approach like training with your grandmother?
Yeah.
Like how would you approach that situation whenever she's afraid of deadlifting from the floor, and you've got, you've worked her to deadlifting off of blocks, but she's just afraid to deadlift off the floor? How are you going to approach that situation? How are you going to approach that conversation? You're confident she can do it. She's not hurt, but how do you approach that? That's probably the same way that you should approach that client who is a little bit afraid of moving forward in a movement, thinking they're going to hurt themselves too.
Yeah, absolutely. Yeah, that's a good way to think about it. So obviously we chatted there about maybe changing the range of movement of an exercise, and trying not to stray too far away from potentially what is planned within the exercise. We've also chatted about progressing back to getting back to whatever their normal was. How does that, whenever there is an injury, and obviously you're going to have to be focusing on what they can do, a lot of people will think, I'm injured, it's going to sacrifice my putting muscle on or losing fat or whatever it would. What are your thoughts on how it can influence the actual results from the client? Would you expect them to maintain the level that they've got and progress and improve their movement as a measure of success, or can you still work towards the other goals that they may have?
That really depends on what their tolerance is, their tolerance to load. So, and then depending on what the goal is. So we can approach this from a ton of different scenarios. Most of our clients probably want to look a little better, feel a little healthier, get a little stronger. So, first thing I might tell them is that, if this seems to be like it's some sort of just like weird non-specific pain that I think they can work through. It's no real like tissue damage that needs to heal. Then, and their goal is to like, is this going to stop me from like reaching my weight loss goals or whatever? You know, I'm not too worried about them being in the calorie deficit in that scenario. So, you know, we might educate them a little more about how, yeah, you know, you probably won't be able to go as hard here, but hey, you know, strength training burns crap all calories anyway. So, you know, let's make it be a little bit more strict with your diet over here. And that's really going to help you to maintain that calorie deficit where we wanted it to be. Well, you know, we're also coming back off an injury, so let's not make that. We really don't want it to be too severe of a deficit. So we might need to go a little bit slower than what you have been doing. And let's get your calories into this range, and you approach it more from that nutrition standpoint, because that's going to be the main thing that drives that result. Versus if we have somebody who has some tissue damage, like they just tore their hamstring and they're coming off of that, like I do not want them in any sort of deficit at that standpoint, because I don't want it to be diverting energy and nutrients and resources away from healing. Mm-hmm. So that's where we might have to have the conversation. Yeah, this really just isn't the time for you to be trying to lose weight while your body's healing from this. So that's there. If somebody's trying to put on some muscle mass, like obviously the nutrition aspect just isn't going to be as much of an issue, because now we have to be in a surplus. We're giving ourselves more resources. So then it kind of comes down to, are you tolerant to the level of load that you need in order to achieve that goal? So if we understand the mechanisms behind hypertrophy, we know that we have to train fairly close to failure, 4 to 5 reps off of failure, with a load between a 1 rep max and say a 30 rep max, probably maybe 20, 25 rep max. So if they can train with any load level, they can tolerate any load level there with any exercise that targets that area, which I guarantee you can find something, most likely. Like you can probably find something for them, then you can stick to that goal of hypertrophy. You can help them continue to put on muscle mass. And maybe that means that they can't train as heavy right now, but they got to go a little bit lighter with some higher reps, because really what we're looking for is that proximity to failure. I don't know if you guys use as coaches, but like in clinical, you know, if I have a client like that, we might be able to use some like blood flow restriction with them, because that would allow us to take that kind of load threshold down to even say like 20% of 1 rep max, and really be able to push that fatigue level up a lot quicker, so that we can keep that stimulus there for them, and that can help them with that. If their goal is strength, then it kind of comes down to, okay, well, can you train 12 rep max or heavier? You know, can you train 6 rep max or heavier for that really max level strength? If you can't do it with a certain movement, is there an alternative movement that we could train into those load ranges with? If we can probably keep you progressing towards that goal, or at least not or at least not regressing. We could at least maintain, and that can be useful. But a lot of it comes down to you have to understand the parameter for the adaptation that you're after. You know, what is that parameter? And then is this person's body currently capable of working within that parameter?
Yeah, absolutely. It's coming down to managing their expectations. So I know a lot of people will be, as soon as going back to that point of, freaking out a little bit about, if they do have an injury that, all my goals have gone out of the window. But like you say there, what can you do? Can we work towards this? And not sort of completely throwing everything out of the kitchen sink. And if all we have to do is maintain, let's maintain, and the priority is right. Let's get back to that normal. Right, like you've mentioned.
Yeah, and a lot of that can come down to the volume levels that you're working at too, to where we know that we don't necessarily have to work at our maximum recoverable volume in order to make progress. Like there's a minimum effective dose we could use as well. So we could say, like, if somebody's dealing with some sort of like lower body injury, well, you could pull their lower body volume down to a level of that kind of more minimum effective dose, where it's a very low risk of us irritating things because we're not doing a ton of work with it. But during that time frame, you're now going to have more recovery ability to maybe allocate more volume to the upper body. And so you might do more volume on the upper body and push that a little bit more and say, maybe like divert the goal a little bit and say, all right, well, we can't do this right now. So we're just going to maintain over here on our lower body. And then but let's use this time frame while we can't push this because squats and deadlifts are super fatiguing. Then we're going to push your shoulder work and your back work and everything a bit more, because that's almost no chance of us irritating the thing we got going on down here. And we have the recovery ability to handle it right now.
I quite like the phrase used there. Just diverting the goal. I quite like that thought of it. What I usually say, again, it was actually a conversation that I had this week with a client, and ultimately, they are going to try and get from point A to point B, to get to their goals. You can get there obviously it's not always straightforward in a straight line, but sometimes you've got to take the scenic route, which might mean, like exactly like you say, you might do a little bit more upper body work if you've injured your lower body. You can still get to the end goal, but it's just going a little bit off track to then repair things and then come back to make sure they get back to where they were.
I really wonder how much of what we do is just like managing expectations, managing loads, helping people not make it seem like it's worse than it is, helping people not lose hope, and just helping them to gradually push their way back, because like we don't have to get stronger to get out of pain. We don't have to get more mobile to get out of pain. Like we don't really need physical change outside of maybe what like Mother Nature is going to do in time to get out of pain. So it's probably a lot more about what you got going on up top, and not losing hope and feeling like you're capable of pushing, taking that next little baby step forward. And so things like this, like diverting goals and changing focus and realizing that it might be a very up and down process. And there's going to be some bad days and there's going to be some good days. It's a lot like weight loss. I routinely use that analogy of weight loss is not linear. You go out to eat and all of a sudden your weight spikes up the next day. Now you can feel like you lost all progress, or you can just jump back on track and in another week you're at a new low. And it was like, oh, that was an anomaly. Well, your bad days are probably like that too. There's gonna be some bad days. You're gonna go out, and because like priority is you wanted to play with your kids that day because you're not going to upset them, and that's a super meaningful activity to you. And going into it, you're going to wake up a little bit more sore the next day, and maybe you have a little bit of a flare up the next day. But it didn't mean that you set all of your progress back that you've made. Just like, let's just get back on track. Let's just keep moving forward. There's going to be a good day to associate with it, and just don't lose hope. Just keep moving forward, and eventually you get there.
Absolutely, I'm a big believer in that consistency beats everything else, and that's all I ask of anyone that I work with. Just be consistent. One bad meal doesn't undo all the other good work that you've put in. Then on the flip side of that, one good meal doesn't undo all the crap that you might have ate as well.
But when you see a consistent trend in a direction you don't like, then you have to have a conversation to get them back on track. Right? Exactly. And that's playing both sides of this argument, in that, you realize that it's consistency, but it needs to be consistency in the right direction. And we recognize when we need to make an intervention as professional to help steer someone back on path. So just don't divert too far off of it, and you'll probably be okay.
Yeah, absolutely. Quite a lot of topics covered on there. I hope everyone has enjoyed that as much as I did. I think it was quite a nice way to round it off there. But for everyone listening, from all the topics that we've covered there and what you've chatted about, what would be your take-home points or words of wisdom, if you would add anything to what you've just said at the end?
Main thing is, I think of everything we talked about, the gist of what I want people to get out of everything I usually talk about is that injury and everything is much more about management of your stress recovery balance above all else. That should be your tier one focus, is your stress recovery balance, in that if you have a bad, like if your recovery is down, you probably shouldn't be stressing yourself as much. If recovery is up, you can probably stress yourself a bit more. And there should always kind of be this balance between things. Don't catastrophize a lot of things and always think that you're broken or you're dysfunctional or that you can't push forward. It's more about just find the things that feel you, find ways to exercise and things that you're comfortable with and begin off of that. And then if you are trying to come back from an injury, just don't lose hope. Just realize that there's going to be ups and downs. There's going to be days where you feel like crap, and there's going to be days where you feel really good. And it really is about just trending in the right direction. I mean, that's what training is too. It's about trending in the right direction. Take the good days with the bad, realize that life is in there as well. This isn't anything black and white. And if you trend in the right direction, you're going to get there.
Absolutely. Some really good points to finish on there. Thanks a lot for taking the time to chat with me. Really, really enjoyed the chat with you.
Thanks for having me on.
Absolutely. I hope everyone enjoyed that as much as I did. For everyone listening, Jake, where can people find you and look at the work that you put out there and the content that you put out there?
My main platform is Instagram. That's where people see kind of my daily exercise videos that I put up, be able to read a lot of my thoughts in the captions and everything that I put there. I write mini blog posts basically every day on that platform. But my handle there is at dr.jacob.harden. I'm also just about on every other social media platform you can find if you just search my name. So that's where I'm at. Anybody wants to come out and see us in person, I teach a course called Rehab 101, open to any health and fitness professional to get more and deeper into these sort of thoughts on injury, rehabilitation, staying healthy, and all that good stuff.
Awesome. 100%. Everyone listening, look for the work that Jacob's been putting out there. Yeah, I know it's helped me quite a lot. I know I've saved quite a lot of the content, the videos you put out there, just for reference to look back at and think, okay, I'm not going too far wrong from there. Thanks a lot for taking the time to chat to me. Really, really enjoyed speaking with you. Thanks a lot to everyone listening, and I will see you all next week.